Hey everybody. Today we're going to be talking a little bit about the mental status exam. So the mental status exam is used typically in mental hospitals or in crisis settings. Sometimes when there are multiple providers caring for a client or a patient. So if there are like multiple doctors that come in shift by shift, because the mental status exam is really used to be like a snapshot or screenshot, if you want to think of it that way, in time of the client's well-being. And it's really to kind of assess their general functioning in terms of like how oriented in reality they are, particularly maybe if there's some thoughts about whether someone's experiencing a more severe mental illness like psychosis or bipolar disorder or schizophrenia. So I'm going to go ahead and share my screen. But you can do these at any time. So don't feel like you can't do a mental status exam. You can do them frequently if you wanted. So a mental status exam is a report on the client's current level of functioning. So it can be really good to track progress and improvement over time and to assess for a variety of issues such as various diagnoses. It's a general exam for a client's mental health. So just like a doctor would do a physical exam, it's kind of like a brief exam of the person's mental health instead of just like a physical checkup. It can help determine diagnosis, and it's like a snapshot in time to help determine changes over time and continuity of care between providers. It's separate from an intake exam, and it's important to understand the client holistically to understand the mental status exam. So the mental status exam is going to be a little bit shorter and less extensive than the intake. The intake might be, multiple pages long. This is again like more of that snapshot. But you're going to need to rely on your information from the intake or your understanding generally about the client to know what's normal for them. Because, for instance, if someone is talking rapidly, that might be normal for them, but it may be that they're experiencing some other symptoms and that's a temporary experience for that person. So the components of the exam are you're going to assess the appearance, behavior, speech, mood, affect, thought process, thought content, cognition, insight, and judgment. So in their appearance, you're going to be looking at their attire, their grooming, their hygiene, distinguishing features such as eye contact, style of dress, and the question I have is, what can appearance clue us in on? So if they come in their pajamas, maybe they've been sleeping for 3 days, and that could tell us a little bit more about their diagnosis. If they're dressed really flamboyantly, that could make us assume, nothing. It could be that that's just their normal style of dress, but it could be that they're in a manic episode and they're having some grandiose thoughts about themselves and they're experiencing a delusion and they're dressing a certain way to reflect that. So appearance can tell us all sorts of things. Hygiene can tell us a whole lot about the state of someone's mental health. And, eye contact can tell us a great deal as well. We're also going to ask and try to assess behavior. So we're going to look for abnormal behavior, repetitive movements, hyperactivity, or catatonic or slow movements, whether they're agitated physically or not. You're going to look at their facial expressions, if there's any bizarre kind of facial expressions going on, their movement, and their posture. You're going to look at their speech, concerned with production rather than content. So is it delayed? Is it pressured? Is it at a consistent rate? Is it fluent? We're going to try to, determine if their speech is understandable and fluent versus impoverished or flat. You're going to mark their mood and affect. So the mood would be their subjective report of how they're feeling. Like they're feeling sad, they're feeling angry. And then the affect would be the observation of the client's emotional state. So if you see that they're tearful, they're lacking eye contact, or they're fidgeting. And you could ask, how's your mood? Have you felt discouraged lately? Have you felt energized or out of control lately? And then you're going to look at motor activity. So facial expressions, their movement and their posture. Excessive motor activity or psychomotor retardation catatonia, or physical immobility. And we're going to assess their thoughts. So are they able to focus? Can they focus their attention? How's their executive functioning? So ordering and implementation of cognitive functions necessary to engage in appropriate behaviors. Nausea, ability to focus based on internal and external priorities. Language, so verbal or written communication. Reading and writing appropriate for education level. What's their memory like? Can they recall past events, or are they struggling with that? And then their orientation, so the ability to recognize his or herself in time and space. So these are the questions like, who's the president right now, and where are you, and what's the date, those kinds of things. And then we're going to look at praxis or apraxis, so the ability to carry out intentional motor acts versus inability to carry out motor acts. So being able to pick things up. Fine and gross motor skills are what we're looking for there. And then thought content, so delusions, hallucinations, homicidality, obsessions, phobias, and suicidality. So that's just a quick, okay, so now I want to kind of show you an example of an actual, components of the mental status exam. So if you're in I need to share. Oh no, you can see it, okay. So if you're in a hospital, they might have like a shortened version of this, and you can just jot down notes next to the different categories. But it can also tell you a little bit about what I told you about before is the categories that you need to assess. And this sample here kind of tells us some of the questions that you can ask, as well as the potential diagnoses if they're abnormal in certain categories. So obviously in appearance and behavior, if someone's disheveled, they could be depressed, they could be schizophrenic, they could be experiencing psychosis. They might, if they're not, showing eye contact, they might be depressed, they might be socially anxious. The mood, if they show that they are irritable, they could be anxious, they could have depression, they could have schizophrenia. There are a whole host of things that could happen. And so obviously, like, some of the thought disorders could lead us in the direction of delirium or dementia, even a psychotic disorder or schizophrenia. So we want to look at all these different things. And in the module, I put a copy of this form so you can take a look at kind of what a mental status exam might entail. Again, that might be something that you would use in an inpatient facility or an outpatient when you're trying to assess a client's mental state. And that's all I have for you today. But if you have questions, obviously let me know, and have a great day.